Hello, Southwestern Arizona. Today we are going to talk about healthcare. And we're going to talk about healthcare at Pebble level, about the state of healthcare now, why it needs reform, what the proposals are, and what direction we need to go. A catastrophic healthcare condition today will bankrupt an American family. Now that fact is un-American. And when I say something is un-American, I mean it shouldn't happen. That's wrong. Every American should exert every effort to correct the situation now. The responsibility of this failure lies in four groups. One, the doctors for letting this happen. Two, the industry for letting this happen to their industry. Two, the lawyers who through their lawsuit abuse are making a bad situation worse. Insurance companies who care only about their survival, and our elected officials who don't have the guts to do the right thing. Despite the failures of our healthcare system, we still have the best healthcare system in the world. Why? Because of scientific innovations that our president is trying to stifle. But let's address those failures now. To do that, for this segment, I'm going to refer to my college economics book, my 200 level college economics class that I took at El Camino College a couple of years after Raul Grijalva got his degree, and describe just basic laws of economics. This diagram is the supply and demand curve by which you get price. The intersection of these two lines is the price of any good, whether that you buy it on eBay or whether you buy it at Walmart. This is the price. And this is what's called a demand curve. The demand curve, basically says if you and I are buying a stuffed animal, okay, and I set that price at $1 million, well, very few people are actually going to be able to afford that. This is a measure of price right here, and this is the measure of potential buyers, okay? You notice that as we lower prices, the number of potential buyers increases, okay? Now, also this is a measure of supply. Okay, so let's look at the supply again. If I'm selling stuffed animals and it's worth $1, okay? Very few people are actually going to go ahead and supply that dollar and supply that teddy bear and sell it to very few people, because there's not going to be a whole lot of that stuff in the market. Okay, but if you increase the price of things, the number of suppliers that are going to come into the market, okay, is going to increase. So, for instance, you could find if you had that same stuffed animal and you're going to sell it for $1 million, you can see that the number of people who are going to supply that is going to be huge. Okay. That figure right there, that right there is the number of suppliers, and this is the potential price. You see that this is a basically linear relationship. The more you charge for something, the more potential suppliers is going to enter the market. So a stuffed animal costs like $2 or $3. It doesn't cost $1 million or $1,000. So that price, the price you get on Walmart, eBay, or buying from a neighbor, is right here. It's that intersection of the supply and demand curves. So that's what people talk about when they talk about supply and demand. Now, what is happening with healthcare? With healthcare is in Arizona we have Access, which is the state-run healthcare provider. We also have Medicare. We have these government interference and government telling hospitals what they can charge, healthcare providers, and it also tells them, it also pays them, but it only pays 80% of the cost. So if you get your leg broken and it costs the hospital $1,000, they'll only Access and Medicare will only pay $800 or 80% of the cost, and they tend to pay late. Okay, so what that does is it creates an artificial shortage. it draws this line right here above what suppliers are willing to create and what customers are demanding. Customers are demanding that the price of goods come down lower. Instead, Access and Medicare is creating this shortage. Okay, and this shortage, whether it be $200 and 3 months being late, is covered by people who can afford healthcare insurance, and they pay for that same leg being broken. They could pay $2,000 or $3,000 for a good that really should have cost $1,000, because the hospital has to make payroll, and it makes payroll by charging people who can afford it more money. And what the Obama administration wants to do, and Raul Grijalva and Gabby Giffords wants to do, is to go ahead and keep making this line bigger and bigger, such that the number of doctors will start, and the level of health care that you receive will get smaller and smaller. Okay? Here's these artificial lines. Okay? Here's where we're at presently, and here's what they're going to propose. They're going to create this level of shortages right here, and then they're going to blame the rich people, okay? And because that's what they do. They like to blame other people for the problems that they create, because they haven't done things like serve their country, held private sector jobs, or created businesses, or actually do anything except serve themselves. What they do is they lie, and then they create these artificial shortages, and that's why you have healthcare being what it is. Now, healthcare is a serious issue in southern Arizona. It's a serious issue for anyone who wants to start a family. It's a serious issue for anyone who's in retirement. It's a serious issue for anybody who's has a family now. It's a serious issue for women. It's one of the reasons why people vote Democratic, is because the Democrats own the healthcare issue. Well, they think they presume a moral authority, but that moral authority is misplaced. Especially when you consider things like medical malpractice lawsuits, which go ahead and drive costs up further, because they go ahead because there's no limits on what people can sue for. It's just a very bad system. And what our elected leaders need to do is to be honest. And that means privatization. That means getting rid of things like Access and Medicare, and starting with having a private insurance cover the costs. If a private insurance company can offer you a policy that covers you in the event of a catastrophic health condition, and they can do it for $25 a month, I mean, are we then achieving the same thing as universal health care? If the cost of health care is down to $25 a month, anybody can afford $25 a month. $25 a month is universal health care, and that's a private system solution that Republicans and conservatives and people like myself have been advocating for years. So when you listen to these politicians talk about healthcare, ask them about medical malpractice, about when they pay and how much they pay of the costs, and hold them accountable. Thank you, Arizona, and have a good day.